Okay, friends, I am Dr. Yadnik and I run the diabetes clinic at the KEM Hospital, Pune, which many of you would know is the first dedicated department of diabetes in the Western India. I have a number of other attachments, notably to ISA in Pune, to CCMB in Hyderabad, and many international organizations. You will see the logo of my unit. The main logo has mother and baby, and this is the only diabetes unit with such a logo because we believe that mother's health affects the health of the child, not only in the uterus, but for the rest of the life. And this is the basis of our research on what we call fetal programming. The other logo you will see is the modern Ganesh. He is a lazy guy. He lies down most of the time. And instead of traveling on the back of the mouse, as he did about 50 years ago, he now clicks the mice. And that is all his activity. That you can well imagine leads to a number of health problems. We are going to discuss obesity, adiposity, and some related facts. Many of you will be surprised because I am going to separate obesity from adiposity, and I am also going to show you some random thoughts, as I have called, which will update you on the modern ideas of why adiposity may be detrimental. The obesity story starts with very simple proper measurements, and two important measurements are, of course, body weight and body height. This looks too simplistic, but I would like you to actually judge yourself. How many of you measure height of the patient at every follow-up, and how many of you measure their height accurately? Accurate measurement of height is not very easy. You need proper instrument, you need proper standardization, and most importantly, you need to follow a protocol so that you don't systematically under or overestimate height. Once you have measured height and weight properly, then we are in business, because then we can calculate an index which we call body mass index, which is used to classify your weight for your height. And that is how obesity is defined, based on the distribution of the body mass index. This is calculated by weight in kilograms divided by height in meters, and therefore the units of BMI are kg per meter squared. The international understanding of this, based on studies mostly in the Western world, in Europeans, and based on the life insurance data of accumulated events, has led to a certain classification which we all use. So if BMI is less than 25, it's normal. Though it's not the purpose of discussion today, if BMI is less than 18.5, then we call it underweight. But not many of patients in diabetes clinic are underweight. Then if BMI is between 25 and 30, we call it pre-obese or overweight. If BMI is more than 30, we call it obese. And then we grade it into grade 1, 2, 3, depending on whether it is up to 35, up to 40, or above 40. Interestingly, I have written at the bottom that the Asian action point is BMI of 23. And the reason for this will become clear as we discuss what is different in Indians and why we are calling it only action point and not a cut point. This is the international classification of adult underweight, overweight, and obesity as I described to you. while discussing the previous slide. This is based on WHO, and there was a WHO 2004 consultation in Singapore. I was part of it, and we have defined these based on a solid experience for Western world. And as I said, below 18.5 is underweight, normal is 18.5 to 24.9, overweight is 25 to 29.9, and obese about 30 with 3 categories. Now, interestingly, when we call someone obese, we at the back of our mind know that he is fat, because in our mind we equate obesity with fatness. So no doubt obesity is an index of fatness, but if you think properly, as we saw, obesity is defined by BMI distribution, and BMI is weight for height. So while defining obesity, there is no fat measurement at all. And obesity measurement of kg per meter square is only a surrogate for body fat, because BMI is strongly related to fat percent as measured by different techniques in any given population. And therefore it is important that there is a difference in body size as measured by BMI versus body composition, where we measure different components, for example, lean and fat. And it's important to remember that BMI itself doesn't measure fat. So then brings in the concept of adiposity, which is what is really important. Adiposity means excess amount of body fat. And quite arbitrarily, when you measure body fat and express it as percentage of body weight, is defined to be more than 25% in men and more than 35% in women. Why this difference? Because we know it's very simple fact that women have more fat than men. Therefore, their distribution is shifted to the right, and therefore an abnormality in women is considered to be more than 35%, when for men it is 25%. Body fat can be measured by different techniques I have listed in this slide, but in the next slide I'm going to show you the pictures. So first one is skin folds, and this measures with an instrument which is called a skin fold caliper, and it's measured at different sites. The standard site at which we measure and where our research has shown to be most prediction of diabetes and other cardiovascular risk factors is in the subscapular area. I don't expect many practicing doctors have used this instrument at all, but we use it in research every day, and majority of our findings were based on skin folds measurements, which led to a lot of discoveries. Then I have shown a machine called BIA, which is Body Impedance Analyzer, and Bioimpedance Analyzer. Bioimpedance Analyzer is a machine which sends a small electric current in the body, and as you know, water conducts electricity, fat doesn't conduct electricity. So when that machine sends a small electric current, we measure its uptake by the body, and then we define how much of body is water. So BIA machine primarily calculates amount of water in the body, and whatever is not water is assumed to be fat, so it gives us a body fat percent. These machines are routinely used in various health clubs. Many of you might have a weighing scale which also measures bioimpedance and gives you body fat percent. But as I would show you later on, it's very important that we use machines which have been specially calibrated for Indians and for Asians. Otherwise, you can get misleading data. One of the modern ways of measuring body fat is to use X-ray, and that is the DEXA machine, which you must know is used for measuring bone calcium, bone mineral density, and to, like say, diagnose osteoporosis. We use the DEXA machine for measuring body fat, body lean, because DEXA is a very reliable way of measuring it. And most of our research is based on DEXA, where we have measured serial DEXA measurements in a cohort of children born in our study. So it's a birth cohort, and we now know what happens to the bone mineral density in Indians from birth to 20-25 years of age. There is a new fashionable machine called BODPOD, where you sit inside the machine. It displaces the air inside the machine, and that allows you to measure density of your body, which in turn can be converted into body fat percent. And finally, I have shown you an MRI machine, which actually allows you to look inside the body and find out fat, especially in the abdomen, so that we can look at fat in the subcutaneous area, fat in the visceral area, fat in liver, fat around pancreas, wherever you want to measure it. That's a very advanced technique. It can be quite expensive, and there are very few people, few clinical radiologists who specialize in these measurements. And that's a section of the MRI fat of the abdomen. And you can see there is a subcutaneous fat and there is a visceral fat, and we will see what is the significance of measuring this a little later. The bad effects of adiposity, that means having high body fat percent, are then further, like say, related to distribution of fat in different compartments. And if there is a bad distribution, then it exaggerates the bad effects of fat. And therefore, we talk of distribution of fat either in the central or the peripheral area of the body. Central means around abdomen, peripheral means limbs, and the new concept of ectopic fat. That means fat where it should not have been present, especially like say in liver, around pancreas, around the blood vessels of the heart, other organs, where it can have a number of effects on the physiological functions, and if there is too much fat, it can cause trouble.